Rebecca could smell death on her patients days before any doctor saw the warning signs. Then one morning, she smelled it on herself. Hook_ND. Her name was Rebecca. She worked the night shift on a med-surg floor in a mid-sized hospital in Ohio. Nothing special. Just a nurse who had been doing the job for 12 years. But something had changed in the last few months. Something she couldn't explain. She started noticing it during a routine bed check. An elderly man with pneumonia. He was stable. Vitals were fine. But when she leaned in to adjust his floor, she caught a smell. It wasn't the usual hospital smell: antiseptic, stale coffee, that faint undertone of sickness. This was different. It was sweet. Slightly metallic. Like overripe fruit left in the sun. She pulled back, confused. The patient's chart said nothing unusual. She shrugged it off. Pattern_interrupt. The next morning, the man coded. He died of a sudden pulmonary embolism. No warning. No signs. The doctors were baffled. But Rebecca remembered the smell. She started paying attention. Every time she got that strange, sweet metallic odor from a patient, she made a mental note. Within 3 days, every single one of them was dead. 7 patients. 7 deaths. All unexpected. All preceded by that same smell. She told a colleague. The colleague laughed. Told her she was imagining things. But Rebecca knew what she smelled. It was unmistakable. And it was getting stronger. Cliffhanger. Act I ends with a question that has no comfortable answer. What if death had a scent, and you were the only one who could smell it? Act 2 begins with a shift. Rebecca stopped telling people about the smell. She knew they'd think she was crazy. So she kept it to herself. But she started documenting. Every patient who died within 72 hours of her smelling that odor. She kept a notebook. Dates. Room numbers. Diagnoses. The smell became her secret weapon. She could predict death. Pattern_interrupt. It worked for a while. She'd smell it on a patient, warn the charge nurse to keep a close eye on them, and then almost on cue they'd crash. Doctors started noticing her intuition. They called it a sixth sense. They had no idea it was a smell. But the smell started to change. It got more intense. More specific. She could now distinguish different notes in the odor. A sweet, floral undertone for heart attacks. A sour, vinegary edge for sepsis. A thick, almost moldy smell for cancer patients who were about to metastasize fatally. She mapped it all out in her notebook. She was becoming an expert in the smell of death. Pattern_interrupt. But the origin of this ability was never clear. Rebecca had no head injury. No near-death experience. No family history of strange senses. It just appeared one day, like a switch flipped in her brain. Some nights, she wondered if the smell was a residue left behind by something older, a presence that clung to the dying. But she never told anyone that part. Then came the night that broke everything. A young woman in her 30s was admitted for observation. Routine. Gallbladder issues. Rebecca walked into her room and the smell hit her like a wall. It was overwhelming. Sweet, metallic, but also something else. Something she had never encountered before. It was cold. Like the smell of a freezer that had been opened after years of disuse. She knew, with absolute certainty, that this woman would not leave the hospital alive. Pattern_interrupt. She tried to warn the doctors. They dismissed her. The woman's vitals were perfect. Labs were clean. She was scheduled for discharge the next morning. But Rebecca couldn't shake the smell. It clung to her clothes. It followed her home. She couldn't sleep. She called the hospital at 3 a.m. The woman was fine. At 4:30 a.m., the woman had a massive stroke. She died on the table. Cliffhanger. Act 2 ends with a pattern that cannot be broken. The smell is always right. Always. And now it's getting personal. Act 3 begins with a morning that Rebecca will never forget. She woke up, made coffee, and then she smelled it. The same sweet metallic odor. But this time, it wasn't coming from a patient. It was coming from her. She checked her arms. Her hands. Nothing. But the smell was there. Faint. But unmistakable. She showered. Brushed her teeth. Changed clothes. It didn't go away. Pattern_interrupt. She went to work, hoping it was just a phantom. But the smell followed her. It grew stronger throughout the day. She started to feel dizzy. A strange pressure in her chest. She checked herself into the ER. They ran tests. EKG. Blood work. Everything came back normal. But the smell was getting worse. It was filling the room. She could taste it now. Sweet and cold. She called her sister. Told her everything. The smell. The deaths. The notebook. Her sister didn't believe her. She told Rebecca she was having a panic attack. But Rebecca knew better. She had seen this pattern too many times. Pattern_interrupt. She went home that night. The smell was so thick she could barely breathe. She sat on her couch, staring at the wall, waiting. And then she understood. The smell wasn't just a warning. It was a countdown. She had been smelling death on others for months. Now she was smelling her own. The next morning, her sister found her. She had died in her sleep. The autopsy showed a massive cerebral aneurysm. No warning. No symptoms. Perfectly healthy on paper. The notebook was still on her nightstand. The last entry was dated the night before she died. It said one word, mine. Cliffhanger. And then there's the detail the autopsy never explained. In her left hand, they found a small, withered flower, a dried dandelion. Her sister swore Rebecca had never picked flowers. The coroner noted it was old, as if it had been carried for weeks. But no one could say where it came from. Some nurses whispered it was a token from the other side. A sign that the smell wasn't just a curse, it was a bridge to something else. But Rebecca never told anyone about the flower. And she never wrote it down. So what do you do with a story like this? You remember that the world is stranger than we give it credit for. And you ask yourself the one question that keeps this story alive: if death has a scent, what does yours smell like?